Governor Ducey signed an executive order capping the amount of painkillers doctors can prescribe. He did this to fight what he calls a growing opioid crisis ravaging our state. Dennis Welch joins us now live from the newsroom to explain this. Dennis?
Now, first of all, the directive limits the first fill of opioid-based prescriptions to just 7 days for adults and all fills for children. And this only affects anyone insured through the state and anyone insured on the state's Medicaid program known as Access. Now, the governor signed the order outside the state capitol this morning to kick off Red Ribbon Week, which focuses on drug prevention. But before he signed off on the order, the governor described the size and the scope of the drug problem now facing Arizona.
There are enough opiates prescribed in Arizona to medicate every adult in our state around the clock for 2 weeks straight. The state of Arizona is currently the 15th highest drug overdose death rate in the nation. And in order to remove our state from this top 20 list, we must pursue every possible breakthrough with urgency.
Now, last year, 401 people in Arizona died from opioid-related drug overdoses. In the governor's office, the move here appeared to be well received from those in the front lines of fighting this drug addiction. Here's the executive director of Crossroads. Now, this is an organization that has the largest residential drug treatment center in the Southwest.
The elephant in the room is a real problem here, especially in Maricopa County. The opioid addiction problem here in this county alone surpasses any other plague that we've ever seen.
Now, this is another very important point. This would not limit prescriptions from those suffering from very painful chronic illnesses or diseases. The governor also hinted at appropriating more state money into state drug and prevention treatment programs next year. In the newsroom, Dennis Welch, CBS 5 News.
Dennis, really quick, this is stepping into medical treatment for people. Was the governor questioned on, isn't maybe this a decision that should be left to doctors?
Yeah, and that was a question that we did ask him. I mean, this is a classic conservative, and we asked if this isn't government getting in the way between the doctor and the patient. And again, he pointed back to that number of 401 related deaths last year. That's more than one per day here in Arizona. And he said, we know there's a problem, and this is how we're going to act on it.
All right, this is their approach. Dennis Welch, thank you. Only 12